One big change in experience will be that for many things that we go to hospital at the moment, we will not go to a hospital. We will instead either just do it remotely, or we might go somewhere else that is not the big, huge building in the middle of town.
Far more care will be delivered through a video consultation. Far more will be delivered by you entering your vital signs. So it'd be very easy just to drop a little bit of blood onto a little adapter that connects to your iPhone. That will read the blood tests. It will automatically do your blood pressure when you put your hand on the phone. It will automatically take your temperature. First of all, you'll make your booking online, the same as you might do for an aeroplane flight at the moment, the same as you might do if you were going to the theatre.
I have this picture of a waiting room outside an outpatients department in an eye hospital, and there's lots of chairs. And that's the very first thing that I'm sure we will eliminate. We will be able to schedule those people that do need to come to actually turn up at the time at which they'll be seen, a little bit closer to 1 in, 1 out than what you see with these huge waiting areas.
It will be a lot of interactions between the patients and then the AI-enabled programs. It can be happening through the mobile phones, mobile device that tells you where you to go, who is the physician you need to visit, and what's the next stop. It could be also some of the screens mounted on the wall, and they will sense and recognize this particular patient. So when they come near, there will be a customized message. I would imagine that in the future, the color of the walls or decorations can be customized and digitally, right? So it can be customized based on the critical scenarios. Sometimes you want to be happier, sometimes you just want to be more peaceful, right? And sometimes you want to be excited about certain things, right? And then these environments maybe can be customized.
When you then turn up in the operating theatre, the chances are that it may be a robot. I think increasingly, and probably by 2030, these will be seen as illegal instruments. We will think it's weird to put big, clumsy, often not particularly hygienic fingers inside the human body. I think we'll go, ugh, weird idea. The robot will do it in a much more precise way, which will mean far less damage to surrounding tissues, will mean far less invasive surgery, which will mean significantly shorter lengths of stay in hospital.
The virtual reality, some of those technologies can help bring family members on site, and vice versa, right? As your loved ones are experiencing difficult times, you can sort of see them rather than texting them or anxiously waiting outside without knowing what's going on.
And I think that if we do look forward 10 years or so, in many, many countries around the world, we will be able to go home much faster. And there's one place that famously puts people into jeans, no gowns, right? No hospital gowns. And just the perception that the patient has of this means I'm myself, and I can do the things that I used to do before the procedure was done, makes a really big difference. That's an example that doesn't take 10 years. What might take 10 years is for it to be adopted routinely in more and more hospitals.
What would the surgeon of 2030 look like? Well, my sense is that she will be somebody who is very good at using digital technologies, perhaps has actually done a first degree in robotics rather than necessarily trained in medicine, first of all, and certainly will have gone and explored how robotics are being used in other industries. So whether it's in the car manufacturing or indeed in grocery stores and so on. So those things will be more important than an ability to essentially do fine motor movements with one's hands.
As early as in the medical schools, right, we should start teaching about the digitalization in the hospital space. We teach about the IT systems and how physicians can be an important part to optimize the system and optimize the processes, and to recognize the value of the technology in the medical care.